Are you one of those who constantly have pain, watering, redness in the eyes, fatigue, eye strain? Then this video is for you. Hi friends, I'm Dr. Gairik from the Department of Cornea, Ocular Surface and Dry Eyes. Today, let's talk about dry eyes. So what is dry eyes? We have a lot of patients coming to us with symptoms of dryness, which includes foreign body sensation, something stuck in the eyes, sometimes redness, and contradictorily, sometimes we have patients coming in with watering who could also have dryness. Normally, we all have tear glands, which are known as lacrimal glands, which help in production of tears. Once the tears are produced, it is distributed evenly over the surface of the eye, and it is prevented from evaporation via glands which are known as meibomian glands, which secrete something like lipids or a fatty-like secretion to prevent these tears from evaporating. Anything which interferes in this will cause symptoms. So how do we evaluate a patient who comes with dry eyes? Dry eyes has two components. One, where the production of tears itself is reduced. The second, which I spoke about, is the fact that tears sometimes evaporate faster than it's held on to the surface of the eye. Now, when you meet your doctor who's evaluating you for dry eyes, they evaluate certain basic investigations, and of course, if at their dispensation they have some advanced diagnostics, that is also something which we can of course ask for. The basic evaluation involves using a specialized grade of paper which is put onto your eye that tells us about the tear production or what is the tear production which is currently there in your eye. The second, which I spoke about, is the fact that many of the times tears evaporate fast. In those scenarios, we might sometimes use special stains which help in us evaluating the surface of the eye, and also it tells us about the stability of the tear film. Sometimes your doctor might also advise certain advanced diagnostics. Now, in terms of the diagnostic equipments which are available, we can also objectively map the glands on your lids, which is very important in maintenance of the tear film. This is sometimes referred to as meibography. We can also use non-invasive latest techniques where certain devices do not even touch your eye, but that can tell us and give us a clue about the stability of the tear film, which is commonly known as a non-invasive breakup time. In scenarios where we feel we might have to go a little deeper, we might also sometimes ask for imaging of the nerves in the eye using tools such as the confocal microscopy. Here at Narayana Nethralaya, we believe in customization, and therefore it's important to understand that no two patients with the same type of dry eye behave the same way. And that is where the role of understanding deeper into molecules play a role. We here have at our disposal a customized biomarker kit where the tears which are evaluated to look at the tear secretion, that is also used to evaluate specific markers in your tears, which gives us better clue as to what type of treatment you would be suitable to and under what type of dry eye or bracket you fall into. In addition to also a thorough systemic evaluation, many of the times there might not be any underlying causes, but in some scenarios, some causes such as rheumatoid arthritis or what we call as Sjogren's, which can directly or indirectly affect the tear production, that also is sometimes what we evaluate. How do we treat dry eyes? Majority of them, of course, include drops in the form of lubricants. We can also sometimes advise certain specific molecules known as immunomodulators, such as cyclosporin or lifitegrast. We also have at our disposal certain nutraceuticals which are known to help in reducing the inflammation because of dry eye, specialized medicated wipes which might also help in reducing your symptoms. What are the advanced treatment options? Foremost is something known as the intense pulse light treatment, where we are using a laser of a particular wavelength, stimulating the lower lids and upper lids, and it helps in reducing inflammation as a consequence of dry eye. We also have at our disposal something known as vector pulsation, where specialized applicators are put into your eye, and that helps us in reducing inflammation or dryness like symptoms. There are other treatment options as well, something known as Meboflow, and all of these are used either in isolation or sometimes doctors might advise a combined therapy. We at Narayana Nethralaya might also customize based on the specific molecules which might be affected in your eye. What is computer vision syndrome? We have a lot of patients coming to us with complaints of dryness, eye pain, strain, and fatigue. And these are the patients who have prolonged uses of either screens, computers, and even devices such as mobiles. Now, when we are doing prolonged screen work, our brain sends signals to our eyelids to reduce the blinking rate, and involuntarily, we are actually blinking less when we are looking at screens. This, in addition to the fact that many of you might be, looking at those screens and devices in air-conditioned rooms, might add to the dryness-like symptoms. We have muscles around the eye which help in a concept known as accommodation, where we are able to adjust to varying working distances. So in scenarios where you are doing a lot of system work, these muscles tend to overwork and can get fatigued. And these are known as non-strabismic binocular vision anomalies, or anomalies which affect the ability of your eyes to adjust or accommodate. So in addition to your dry eye tests or advanced dry eye diagnostics, which we have, we also sometimes might advise certain tests to look at these muscles, and if required, advise exercises which also can help in improving the symptoms which you have. So friends, dry eye disease is sometimes loosely used, but it encompasses a lot of thinking and a lot of factors which go into evaluation. So when you have complaints of dryness, do make sure to visit your dry eye specialist.